cancer. And I said, well, what it means is that anyone with TB would test positive. And therefore, they should not be given antiretroviral drugs. And that was almost like I was saying that there was no God in heaven, that I committed heresy. Everywhere I went in South Africa, there were adverts up saying, Sweet 16, HIV wants to sleep with you. Everywhere. Forcing governments to spend their money on antiretroviral drugs, not spending it on clean water supplies. Other scientists that was researching malaria found they were starved of money because all the money is going into AIDS. And any doctor worth their salt in Africa now who wants to get funding for their practice has to say that their patients have got AIDS, which is really easy if you define it so broadly. Any patient who wants money has to say they've got AIDS if they want money. The whole social welfare and medical system in Africa has been bent by this. It's just atrocious to see it. I mean, even in my practice where I go for my own personal doctor in England, the nurse I see is a former African specialist. She was out there in Africa, and she was telling me how she was absolutely starved of funds because she wasn't treating AIDS patients, she was treating malaria patients, and she couldn't get funding. And this is
there's another aspect to this as well. Look at every country in Africa. If Africa is infectious and it's sexually transmitted, then it should be everywhere. Why is it that in the more prosperous nations in Africa, you don't have the AIDS epidemic? You continue to see it where you have refugee camps, where you see poor people, where they don't have clean water, they don't have good nutrition. Yes. They're suffering from multiple parasitic infections. They have tuberculosis because they're in close proximity to other people in these camps. And yet they will use the numbers from a camp and so state that it represents a whole area. And it doesn't. And unfortunately, this is where the pharmaceutical interests have total control. And then they end up influencing the Bill Gates and Bill Clintons, and then the people who support raising money for African AIDS causes. And if you really want to help AIDS in Africa, then set up clinics to treat people for malnutrition, malaria, tuberculosis, schistosomiasis, and that will help them. In fact, we contacted the National Institutes of Health, and I said, I'd be willing to take 100 persons that you diagnose with full-blown AIDS, and we will work with them for 6 months, where you take their blood chemistry and see how well they do at the end of 6 months compared to a group given your antiretrovirals. Didn't want to take that. Didn't want that challenge. Until such time that we have more scientists challenging the medical editors at Science magazine. I get it back to this. You're going to have to take this debate to the magazines, because they're the ones that give credibility to this whole hypothesis. It is my request that write to the editors of Science magazine and Nature magazine and the New England Journal of Medicine, the American Medical Association magazine, Journal of the American Medical Association, the British Medical Journal, and the Lancet. Challenge them. Say, why won't you allow a guest editorial with documentation that would prove that, that there is lacking science in the discovery of the HIV virus? And if she can't provide them with that proof, then let them challenge her, let them discredit her.
And my films have been shown on the BBC at peak periods. But if you go on the BBC website, I'm ashamed to say that it's got a large section on HIV science, which actually says end of debates. So I open up the debate section. There is no mention of a single scientist who calls HIV into question. I have friends who try to post stuff on the BBC website, and it is deleted if it questions HIV. This is against medical ethics. It confronts the basic principles that you make. I've worked on Panorama, major prestige British programs. It's a conflict of journalistic ethics not to report two sides of a debate. It has to be done. This is being violated constantly by Newsnight and all our top programs.
So the American media, the British media, the French media, media around the world are culpable to special interest groups, advertisers, but let's ask for debate. Let's ask for dialogue. Do we have questions from people in the audience? Please give them to us. And anyone in this audience who would like to address the world, address this issue, the forum is open. Please come forward and we will take your questions. All right, here's two questions from Walter from Arlington, Virginia. If AIDS is not a virus, how did healthy people like Arthur Ashe and Magic Johnson contract AIDS? What could have caused them to get sick?
I don't know the personal circumstances.
Okay, well, I certainly will give you this. Arthur Ashe was not healthy. He had nearly died. If you remember, he had massive heart operation. And therefore, he was taking mildly depressed. So it would have been very easy for him to have cross-reacted to an HIV antibody test, again, which is non-specific. There are over 70 different conditions that you could have, including the measles, including flu. If you get a flu shot, you could test positive. And then put on the medication. Now, I met Arthur Ashe. Arthur Ashe came into my clinic multiple times. And he would sit there for hours on end and speak with the people who were getting the holistic lifestyle modification. He would look at their medical records. He would speak with the physicians. And he was very interested, but he said that he did not want to disappoint his doctors by trying this therapy. Even on Tony Brown's Journal, he sat with me on national television when I discussed what a holistic model was and the limitations of the existing model. And he said he would try it. He never tried it. But Arthur Ashe was extremely ill and had major surgery.
Gary?
One second. As far as, I'll come right to you. As far as Magic Johnson, keep in mind that when you have sex and you have any kind of virus or bacteria, if that cross-reacts, you can be given a diagnosis and still be healthy. Or you could have hepatitis, you could have herpes, you could have any number, 70 conditions, and test positive. I was contacted after Arthur Ashe by someone close to him and asked for a holistic protocol, which I was happy to give them. But at that time, we didn't know that you could cross-react. That would come out later based upon the outstanding work of Christine, what's her last name? Christine Johnson? Yeah. Who?
Christine Marjorie.
No, Johnson. And who showed that all these, and by that, at that time it was 45 things you could cross-react, now it's over 70. Now this is in peer-reviewed literature. So the assumption is that you have nothing in your body that could cause you to have this. And let me also mention, many, many, many times in Africa, completely normal lifestyle, heterosexual women who've never had sex ended up being diagnosed with AIDS because of other lifestyle factors like malaria, tuberculosis, malnutrition, and put on the AZT or the other drugs, DDI, DDC, protease inhibitors, etc. But they're also shamed. Even when they've been shown, even women who've been shown that they were virgins were still told that somehow they must have had sex. And we forget that the majority of the people in Africa hold sex in a different manner than we do in the United States. They are not liberal about their sexuality. It's a very sacred process. So we've condemned in the almost colonial racism a nation that's all having sex, and therefore safe sex ads and safe sex programs with condoms, even among virgins. So there's so much bad science on this.
Gary,
Yes.
blood transfusions were alluded